Welcome. Today we're diving into multifocal atrial tachycardia, or MAT. This specific type of heart arrhythmia can be complex, so we'll break down everything you need to know, from its causes to its treatment and beyond. So, what causes MAT? Typically, it's linked to underlying lung conditions like chronic obstructive pulmonary disease, or COPD. It can also be triggered by conditions that put stress on the heart, such as heart failure, pulmonary embolism, or even certain medications, electrolyte imbalances, or severe illnesses. The common thread is often significant strain on the body. Let's get into the pathophysiology. Normally, the heart's electrical signals originate from a single spot in the upper chambers, called the sinoatrial node, or say node. In MAT, however, these electrical impulses come from multiple locations within the atria. These rogue electrical signals compete, causing the atria to fire rapidly and irregularly. This disorganized electrical activity leads to a fast and chaotic heart rate. MAT isn't the most common arrhythmia, but it's frequently seen in elderly patients with chronic lung disease. It is estimated to affect about 0.4% of people hospitalized with COPD. It tends to occur more often in people who are already quite ill, particularly those hospitalized with respiratory problems. What are the signs and symptoms of MAT? Because the heart is beating rapidly and irregularly, it may not be able to pump blood effectively. This can cause a range of symptoms, including a fluttering or racing feeling in the chest, shortness of breath, dizziness, fatigue, and even chest pain. In some cases, there may be no noticeable symptoms at all, and it's only detected during a routine ECG. How is MAT diagnosed? The primary tool is an electrocardiogram, or EC. An ECG records the electrical activity of the heart and reveals the characteristic irregular atrial activity and multiple P-wave morphologies seen in MAT. The presence of at least 3 different P-wave shapes, along with an irregular atrial rate exceeding 100 beats per minute, confirms the diagnosis. Blood tests to check for electrolyte imbalances and oxygen levels are also important. While we don't have subtypes in the traditional sense for MAT, it's important to differentiate it from other atrial tachycardias, especially atrial fibrillation and atrial flutter. Unlike those conditions, MAT has distinct P waves with varying morphologies, indicating multiple foci of origin. The differentiation is crucial for treatment selection. Managing MAT focuses on addressing the underlying cause. If COPD is a factor, optimizing lung function is essential. Correcting electrolyte imbalances, such as low potassium or magnesium, is also crucial. In some cases, medications like calcium channel blockers or beta blockers may be used to slow the heart rate. However, they may need to be used cautiously, especially in patients with lung disease. Cardioversion is generally not effective for MAT. In rare cases, when medications are ineffective, a V-node ablation with pacemaker implantation may be considered. Preventing MAT involves managing the underlying conditions that contribute to it. For example, for individuals with COPD, that means following their prescribed treatment plan, including taking medications as directed, avoiding smoking, and getting regular exercise. Maintaining a healthy lifestyle, including a balanced diet and regular checkups, can also help reduce the risk. The prognosis for individuals with MAT varies depending on the severity of their underlying conditions. While MAT itself isn't typically life-threatening, it can worsen the prognosis of the underlying illness. Recent research is focusing on refining treatment strategies, particularly in patients with COPD. There is also increasing interest in developing therapies that target the specific electrical abnormalities that cause MAT, but this research is still in its early stages. As our understanding of this complex arrhythmia evolves, so too will our ability to manage it effectively.